All righty, we're at 12:30. Good afternoon, everybody. Thanks again for being here. I really appreciate it. Must be a pretty hot topic. We got a lot of people in here pretty early. But today I'm talking about knee pain. Okay. Um, I could probably make a whole month out of knee pain. So I kind of generalized it to what I find to be the most common issue with knee pain, which is arthritis. So we're going to talk a little bit about that. Let's just go ahead and jump into it. Share my screen. All right, does everybody see knee pain?
Yes.
Perfect. Okay, so we're just going to jump right into this. You know me, I like to start with my anatomy. Okay, so kind of hard to tell, but this is on the left here is the back of a knee. Okay, you can see the joint inside of, in between all those muscles. But I just want you guys to get an idea of how many muscles cross over the knee. Okay, so on the left here, we have two of the hamstring muscles, and then on the right, another hamstring muscle. A couple other little guys here, and then you have your calf muscle, the one that everyone sees on the upper part of your calf, crosses the knee. Okay, then on the right side, we have a side view. Okay, this is the outside view looking in. You can see the old famous IT band over here on the right side crosses. And then you have all your quadriceps muscles coming across, crossing. And then the front, you have what we call the patella tendon in the front, where all the quadriceps muscles kind of attach to the kneecap and cross over the knee. Okay, so you can see a lot of these muscles cross that knee joint, which is going to be important for us here in a little bit. Okay, underneath all those muscles, so you can see all the muscles are kind of retracted here and cut back. We have what we call a joint capsule. Okay, a lot of what I talk about today is going to apply to pretty much most joints. Okay. So you can see this knee capsule here, all this white tissue kind of covers everything. Okay. This is another crucial part of.
I thought cats like sauce.
And can I have everybody go ahead and look down and make sure your mic.
Yeah, really was.
It'll give us less interruptions. All right, so back to the knee joint. Excuse me. So you can see this joint capsule wraps around this whole joint. Okay. Let me check this chat real quick. Now, there are 4 stages of arthritis. Okay. You got 1, 2, 3, 4, and you can see here, it just progresses. You can see it progressively getting worse and worse. Okay. So we have these cool little discs, on the top part of our lower bone, our tibia. Those cushion our knees. When these start wearing away is when we start, associating that with, our quote unquote arthritis, where we, again, quote unquote bone on bone. Okay. It's never really actually bone on bone, even though some people may feel like it. It's just essentially these cartilages in here wearing out, and it's just causing more and more pain. Okay. So what we want to do with that, let's see here. So this is my take-home message here. This is what I want you guys to implant into your brains. Okay, this is the osteoarthritis cycle. Okay, so we can jump in here anywhere you want. Okay, so let's start with inflammation and pain. Okay, so we get some pain in our knees. We get some inflammation. We went for a walk too far. We maybe went up too many flights of stairs or whatever it may be. Okay, when it's inflamed and painful, we're gonna try to find a position that relieves that pain. Okay. Typically, that position is going to be where the muscles in that capsule are in a shortened position. Okay. Meaning things are going to tighten up. We're also going to rest it. We're not going to want to continue to exercise. Okay. Because continuing to exercise, we either in our minds convince ourselves that it's going to make it worse, or if we did some significant damage, it could make it worse if you do too much of the wrong exercise. Okay. And without exercise, so one of our little cheesy phrases is motion is lotion. Okay, so the more we move, the more we create a pump within those joints, within those joint capsules. Okay, that's pumping the good stuff in and the bad stuff out. So if we're not moving, we have poor cartilage nutrition. Okay, so that those meniscus in there, those cartilages aren't getting the nutrition that it needs. Okay, that's going to cause it to break down. Okay, when it starts breaking down, even just the slightest, and we get that cartilage damage, that's going to tighten everything up. Okay, so think about the layers that are there. We have the joint capsule underneath and the muscles around that joint capsule, right? So if that cartilage damage is causing that joint capsule to shrink, even just in the slightest, that's going to cause the muscles around it to shorten and tighten as well. So now when we maybe start feeling a little bit better and we start walking more or do stairs again, we're going to trigger those tissues to become inflamed and painful even more easily because everything's already in a tightened state. Okay. And then boom, look, we're going to go right back into this. Okay. It can be true for the hands, knees, hips, just about anywhere. Which is why it's very important that we stay moving. Like we talked about in week 1, the most important thing is that we move, right? Doesn't really matter what position you're in, we need to move. Okay, so how can we target the knee to keep moving? Okay, well, first of all, number 1, don't baby it. Okay, so the first thing people want to do is they want to stay off of it and like completely avoid using that joint. Okay, perfect example is when the knees are kind of inflamed, people want to avoid steps. Okay, well, I understand, Tammy. I understand it hurts. Yes. And there's different levels to this stuff, and I completely understand that. Okay, so if something's like excruciating, obviously we want to, kind of take it a little bit easy. But we don't want to just sit there and do nothing. Okay, we do want to, start with some stretches, start with some light loading. We want to do what we actually can without making ourselves completely miserable. Okay, so we want to actually use it. Go for a 3-minute walk, 5-minute walk, 15-minute walk, whatever it may be. What I have seen is when the knees are sore, people approach some stairs, is they're hesitant to walk up the stairs with let's say the right knee is worse than the left. They're hesitant to go up a step with their right knee, and they'll kind of favor the left knee and just go up each step with the left knee. Okay, what you actually want to do is turn sideways, go up the steps sideways using that right knee. So that's going to put less stress on the knee because you're going sideways versus going forward, which can put a little bit more stress on the knee. But use that one that hurts a little bit more. It might be a little bit more sore. Okay. Again, this is based on the fact that you can actually do it and it's not debilitating. Okay. It's just the whole don't baby it, don't favor it. Try to use it as much as we can. Okay. If that's 5 steps, 10, 1 flight, whatever, you kind of got to make that determination for yourself. Okay. And then we're going to go back to our basics, lengthen and strengthen, right? So we're going to stretch what's tight and we're going to strengthen what's weak. Okay. Excuse me. Well, whoops, didn't mean to do that. Let's go back to that. What was the chat that I saw that I like? I've heard up with the good and down with the bad. Yes. So that would be specifically for like an injured leg. Okay. So we want to use the good one to do the work on going up. And then we want to use the good one to support our weight as we're going down. So the more painful one would be, leading down as you go down the stairs. So yes, that's a very good little mnemonic that we use, whatever it's called. Another thing that we can do, lose weight. I know no one likes to hear that, but every extra pound you have, that's extra pressure and impact on those joints. Okay, knees, hips, whatever it may be. Even just 5 pounds is going to help alleviate some pressure on those joints. Okay, that's probably the hardest one on here. Absolutely, I get that. But all of these things are going to contribute to decreasing that knee pain. Okay, and then we can get into the skilled portions of it with manual therapy. Okay, there's different techniques, there's different things that we can do as therapists to get our hands on our patients to help those joint spaces, to help the muscle stretch, the joint capsule stretch, all that good stuff. Okay, so those are, I would say, the top 5 things that we can do if we start experiencing knee pain. Okay, I know that word osteoarthritis, scares people, and you're like, oh, there's no way I'm at an age for osteo. Trust me, it doesn't pick. Okay, if you were a high school athlete and you kind of used and abused your knees, you know, 35, 40 years old very easily can start feeling arthritis. Okay. It's just not for the older geriatric population. Okay. And it can affect anybody. Okay. Now, here are some stretches. Okay. So, two of these are pretty simple. So, I'm not going to demonstrate those ones. This first one here, you can see he's nice and long all the way through that back leg. Okay. So, that foot stays flat on the ground. Keep that heel flat on the ground. Okay, and you should feel a nice stretch all through the back of the leg. Okay, so we're hitting hamstrings a little bit, and we're hitting some of those calf muscles. Okay, then the next one here, you just find a little elevated surface. Keep that leg straight. The key to this one is chin up, chest up. Okay, so don't round your back trying to get further, because all that's doing is stretching our back. That's not stretching the hamstrings. Okay, so chin up, chest up, lean forward. Think of it as trying to put your chest to your knee versus your nose to your knee, if that makes sense. So chest to your knee, that's going to help you keep your chin up and chest up and really get a good stretch in the back of the leg here. Okay, this one I'm going to go over on camera because there's a couple little things that I want to touch on with that. I know some people are like, nope, that's not going to happen. I get that, but we can do it in standing. Okay, there's a way we can modify that. Okay, that's just the more aggressive way to do it. So, and then some of the strength training exercises that I like and I see often. Here's your step ups. Okay, so when you step up forward or step down forward, we get that knees past the toes, which is functional, but it can cause more pain. So it's not a bad thing that your knees go over your toes. It's more about doing it correctly. So that one tends to be a little bit more challenging, whereas stepping sideways, you can kind of have that foot a little bit further forward. But that really helps strengthen that, you know, top knee. Okay. Then you have your leg extension. We have machines, and I believe most of our facilities that have a leg extension component. You just put the weight here in front and kick that leg out, trying to strengthen those quadriceps muscles. Really easy one here. You just, you know, you can stand one leg, two legs, and you just try to go up on your toes. Lift your heels up off the ground as high as you can, strengthening that calf muscle. Okay. And then this last one here too, I'm going to go over on camera as well to kind of give a couple cues on that one. Okay, so let me go over those two real quick. All right, everybody see me again? I don't see me. Okay, there I am.
Yes.
Yes, we see you.
Okay, so that first one that everyone kind of cringed on. Okay, so we got this little pad here for the knee. Okay, so we can start it a little bit more simply. Okay, let me go front knee. See, no. Here. Okay, so this is the one we're trying to stretch here. We're trying to stretch one of the muscles that goes all the way down and up back here. Okay, so the idea is to be able to grab the foot, and I'm going to fall off this table, and pull here to get a good stretch of our quad. Okay, I understand that can be very challenging for some people. Okay, I like that position because of what you can do with your hips a little bit more easily. So I think we went over in another video how to stretch the hip flexors, and it's here. And the approach is to push the hips forward. Okay, so as we push the hips forward, you're going to stretch this here. But what I want is to stretch another muscle by bringing this up and doing the same thing. Okay, so we can still target that muscle, just not as aggressively in standing. Okay, so that's your simple quad stretch, where you just stand here, grab your leg, pull it up. But the thing that tends to happen is the knee tends to travel forward. We want that knee to be behind us as we do this stretch, and our hip forward. Okay, now you're getting a good stretch of that bothersome, troublesome muscle that crosses the knee. Okay, so that's the big takeaway there. Like I said, the other ones are pretty straightforward. The last exercise on here, we want to teach a hip hinge. So it's not just bending, and I know it's harder for you guys to see me. It's not just bending at the waist. Okay, we don't want to bend in the lumbar spine. Okay, we want to do what we call a hip hinge. That's our hips going back as we bend at the waist. okay? As opposed to just kind of going straight down, and now my back is rounding, versus a hip hinge where my lumbar spine is staying nice and flat, okay? So now if I'm on a single leg coming down, my back stays nice and flat versus trying to bend down and touch my toes. Not the easiest to demonstrate on camera. It's a lot easier to kind of walk through individually, but yes. Do you need safe start, Dr. Carney? Okay, so again, that's very quick. That's my 15-minute time limit. Anybody have any questions on knee pain? And I know that does not cover all knee pain. If you have pain in the front of the knee and the side of the knee, there's just so many things going on in the knee, it's hard. Okay, it's hard to cover everything. However, for you, if anybody would like to come see me and let me check out your knee, or anything that we've kind of gone over in any of these topics over the last few weeks, here's a link to book an appointment and come see me. Okay. Just old knees. I don't like that excuse. Okay. There's definitely something we can do to either help or at least put off the onset. Okay. Keep it at bay as much as we can. Okay.
Hello.
Yes. Someone got a question? Yes, Leslie. Losing weight will help tremendously. Absolutely. Supplementation is a little outside my realm, but good advice. I'm crying already in anticipation. Should you use a knee brace? That's a great question. It depends on what kind, first of all. There's probably 150 different kinds of knee braces on the market. Okay. The compression sleeves, a lot of it's psychological. If you think it's making you feel better and that's keeping you from babying it and favoring it, I'm all for it. Okay. The compression sleeves might help keep some of the inflammation out that we don't want in there. So I'm all for it. Okay. Is it going to support? Is it going to strengthen? Is it going to do any of that? I don't really know. Okay. Same as kind of like a back belt when you're lifting. There are different kinds of knee braces. So if you have the arthritis already kind of set in and you want to separate that knee joint to make it feel better, they have a knee brace that you can get fitted for that'll kind of pull those two bones apart and help support it so you're not hitting as much with each step. So it's individual. It depends on what your individual situation is, and whether or not a knee brace would actually work for you. Okay. Radiating knee pain. So is that radiating to the knee? Is it from the knee down? There's a lot going on, and that's a loaded question for me. And Tammy, you have nothing to be worried about for tomorrow. Okay, I'm gonna take good care of you, I promise. Whenever you do the exercise and you know you have knee problems, should we use ice afterwards? I would go with no. So ice is going to be for pain. Okay, so we don't want to be so aggressive when we do these exercises that it causes so much pain the next day or later on that we need ice. Okay, so if we're at a point where we're doing too much, we're being too aggressive, and it's that painful that you want to ice it, then we want to tone it back. Okay, we don't want to do that much work that quickly. Okay, maybe do one of the strengthening exercises and one of the stretches until you kind of see how you respond. Okay, any of the knee pain, any of these issues could be coming from just one muscle. You might have tight calves. Okay, so that's one of those things we would look at in physical therapy to see which muscles are tight. Okay, if your hamstring range of motion is fine, I'm not going to have you stretch your hamstrings, but if your calf muscles are tight, that's where we're going to focus. We're going to focus on lengthening those calf muscles, and then we're going to look at the joint capsule and kind of see if we can kind of do some stuff for that. But again, so I would avoid the ice. Again, it's just for pain management. It's not going to really help with the things that we're trying to accomplish. Yes, Tammy, I can look at your hips as well when you come see me tomorrow. Great questions, guys. I love this stuff, so keep them coming. Hips. So is that what you guys want me to do next week? Hips? Okay. I will do a hip talk next week. Yes, Russell. You guys crack me up. All right. So we'll do a hip talk next week. I will see what I can conjure up. If you guys have any specific questions, if you want me to look at your hips individually, please do book an appointment. I would love to check out, see if I can find anything tight, see what's causing your pain or discomfort, see if there's anything that I can help you feel better. If there's no more questions, then thanks again for coming. Please sign that form so we can track who's here. And I hope to see you guys. I'll stay on for a little while. You guys can feel free to jump off. But again, if you have any questions, feel free to jump on and ask.
Thanks, Wayne.
My pleasure. You
Thanks,
guys
Wayne.
have a great day.
See you later.
Wayne, I've got a question. Do you think I'm drawing a blank for the name, the devices that they use to give the electric stimulation to trigger muscles to alleviate back and neck pain, can that be used on knees?
It depends on what you're trying to accomplish with it. Okay. So something like electrical stimulation is what we call, quote unquote, a Band-Aid. Okay. It's going to make you feel better, but it's not going to fix the issue. Okay. So it's going to alleviate the pain so that we can then be more aggressive elsewhere to help strengthen or lengthen whatever's dysfunctional elsewhere. Okay. So for instance, perfect example is a lot of electrical stimulation is used for like the knots in the neck or in the low back. Okay. And it's so painful that I can't stretch you. I can't do the exercise that I want to do to help, help fix what's going on. So we put the electrical stimulation on to help you relax, and then we can kind of target what we want. Okay, so it'd be more of, sure, if it helps you feel better, I'm all for it. Okay, if it alleviates your pain, I'm all for it. But it may not fix what's continuing to cause that pain. Okay, so typically electrical stimulation, the only thing that it's truly, truly beneficial for to help progress somebody is, like maybe a stroke patient who has very, very, very little strength or muscle activation. We'll slap those electrodes on there and we'll crank them up to get that muscle firing to help reconnect the signals. Other than that, it really doesn't do much except for alleviate pain and help you feel a little bit better. So it's not going to fix the issue, just kind of cover it up so we can actually fix the issue. That make sense?
That does make sense. Fixing the pain can go a long way to helping though.
Absolutely.
Sometimes. So I appreciate the answer on that.
Yeah, for sure. I just read nerve gliding has helped my neck pain. That's fantastic. I literally just got goosebumps when I read stuff like that, because this is why I do this stuff. But like, if one person can alleviate their pain for one day from what I say, then it's a win. So I'm glad to read stuff like that. Where can I get the link to make an appointment? I'll go ahead and post that link again. Oh, it's trying to send it directly. How'd that happen? There we go.
All right. Thank you. Have a great afternoon.
My pleasure. You guys too. Y'all take care.
Thanks, Wayne.
Absolutely.